Well, good morning. Thank you for joining this Lunch and Learn. We are the nurse practitioners regional leads for the provincial initiatives and programs team housed within NNPBC. We're happy to be here and are thankful for all of you joining us this morning for this sharing of information. Before we get started, I'd just like to take a moment to allow everybody here to introduce themselves. I'll start with myself. My name is Annalise Hassler. I'm a nurse practitioner over here on the traditional unceded territories of the Shishal and Squamish Nation, also known as the Sunshine Coast. I am one of 3 regional leads for the Vancouver Coastal Region.
And I can go next, as my name seems to be next on the list there. My name is Lise Dawson. I am a nurse practitioner and one of the regional leads on Vancouver Island. I reside on the traditional and unceded territories of the Snuneymuxw First Nation, colonially known as Nanaimo. And I'm one of 2 nurse practitioners on Vancouver Island for the regional leadership team, not 2 on Vancouver Island. And I'll pass it to Chelsea.
Thought we were going in order there for a minute.
Oh.
I am Chelsea. I am a family nurse practitioner of 8 years. And I am calling in from the traditional territories of the Katzie and Kwantlen First Nations, and happy to be here speaking with you today. Annie, go ahead.
My name is Annie. I am a family nurse practitioner of around 6 years. I am also one of the Fraser regional leads of our provincial initiatives program. And I am calling in from the unceded ancestral territories of the Coast Salish people. And I'm happy to be here.
Amazing, thank you. Next slide. So as we set off, we'd like to take this moment to acknowledge that NNPBC serves and supports nurses and nurse practitioners working across the province in what is colonially known today as British Columbia, home to 202 First Nations, Inuit, and Métis communities. As an organization, NNPBC is committed to anti-racism, and as our profession, our nursing profession is dedicated to social justice and equity. We stand in these relationships with humility and respect. And I just ask that each of you take a moment to reflect on the community that you are joining us from today, and acknowledge that we are all, if not most of us, uninvited guests on these lands, and to take a moment just to appreciate where we are. Next, I'd like to take a moment to acknowledge that it is Nurses Week, and we as nurse practitioners are so pleased and proud to be part of the nursing family. All of the different designations within nursing, it takes all of us. We are a community, and what we bring and how we keep our communities healthy, it takes all of us, and just always so proud to be part of the nursing family. So to each of you, happy National Nurses Week. I hope that there's been opportunities for you to be celebrated for the work that you do. Our next slide here shows the objectives. So this is what we're hoping to go through today with you. It will give you a little bit of a background on why our team exists and how it came about. We will give a little bit of an overview of who is on our team and a review of the programs and resources available to all publicly funded primary care NPs, why it matters, and how nurse practitioners can be supported with this program. So quickly, this is just a little bit of a structural overview of how the nurse practitioner component of NNPBC is housed within the organization. So you can see here, there's the board of directors, and then the 2 kind of lateral sides. One is the NP Council, which is, our nurse practitioner council, similar to the RN Council, LPN Council. And this is, the council is the infrastructure around advocacy leadership. It's where they take our concerns around what's happening within our profession, whether that's wherever you're working as a nurse practitioner in the province, and able to provide that feedback so they can at their tables, whether that's at the ministry or in negotiating, all the different tables that they attend and present to, can bring our concerns forward and advocate it on our behalf. And they also have the negotiating team. So when it's time to renew contracts, they bring some of those concerns that we have forward so that as our contracts are renewed, that the margins and the gaps and the difficulties and challenges that we have in providing care or just being engaged as a profession are being addressed. And the other side is of the nurse practitioner side of the operations structure here is where we sit, which is the primary care program, the practice support program. And you can kind of see it all laid out there. I don't think I need to go bit by bit, but it's definitely in and around how we support nurse practitioners in publicly funded positions through QI work, through engaging in cultural safety and humility, education opportunities, and you know, how our team is the infrastructure of our team and how we support the PCNNP and the primary care network generally. And then also some of the core functions of where our work informs policy, advocacy, practice, research, education, and such. So this is really important, and it comes up from time to time. Many people question where the funding comes for our team and the work that we are doing. And I think that what we'd like to impart is that the funding for our team comes from a shared cost agreement, so directly from ministry with direct deliverables. It's informed by and directed by the Ministry of Health or the Nursing Practice Secretariat. And the funds don't come from the annual membership fees that nurses and nurse practitioners pay. So this is very explicit funding that has very specific mandates and deliverables to be able to carry out and conduct this work. And you can see that the leadership program, the leadership team, the practice support program, all of the funding comes directly from the ministry.
I think there we go. We had missed a slide. Annalise, are you passing it off to me now?
It's your turn, milestones.
Sure. We need the next slide though, please.
Sorry, Andrea.
Super.
You.
No worries. It's a Thursday morning here. I don't know why we're all so slow, but we are. Thank you for coming and listening. I'm just going to talk a little bit about some of the milestones and the contract updates. So the Provincial Primary Care Transformation Strategy was initiated in 2018, and this was occurring when we had a change in the provincial government. As part of that strategy, a new funding model was added for nurse practitioners. So prior to 2019, most nurse practitioners were almost entirely working for health authorities, and very few were in primary care. They were health authority employees. With a change in provincial government, there was a willingness to look at primary care delivery and include nurse practitioners in this formula for change. The first nurse practitioner contracts were signed in 2019, and since that time, we've had 3 iterations of that contract. With each new iteration, there has been changes. We are now in year 6 of those contracts, and there's still improvements that can be made. And as time goes by year after year, we're all learning. The nurse practitioner contracts are for 3 years, and NPs are working as independent contractors. Through consultation and the support of the Ministry of Health, the Provincial Initiatives and Programs, which we affectionately call PIP, was created in 2020. And this is to help integrate and support independently contracted nurse practitioners. And since 2020, the program has continued to grow in the number of team members, the areas that we are supporting, the funding, and the programs that are being offered. The NNPBC PIP team is an umbrella term that is used to include 3 areas: our practice support program, our provincial and regional leadership team, and our reimbursement program. Next slide, please. So yes, this is a bit of a busy slide, but we do think it's important. The practice support program was launched in July of 2020. This is just a basic timeline that shows the rollout of the PSP practice support program, so that you can kind of see when things started. Many of these programs highlight the advocacy of the PIP regional leadership team. We receive and share feedback that we get from independently contracted nurse practitioners about their practice needs. The Nursing Policy Secretariat continues to partner with our team to help facilitate program development and help support independently contracted nurse practitioners. The first program that was rolled out was the funding for continuing professional development for CPD. Some examples of further milestones were in 2021, we started the Community of Practice for nurse practitioners, and the regional leadership team hosts this monthly meeting where we have the ability to provide updates, have speakers, and engage with the contracted nurse practitioners. As well, we had the start of the Clinical Corners series, which started in 2021. These are educational sessions that we organize and set up. Originally, they were every 2 weeks, and now they're weekly. We have multiple reimbursement programs that have continued to be initiated over the years to support the important work that NPs are doing, such as quality improvement support. Newly added this year was our cultural competencies and anti-racism training funding. We continue to evolve these programs as part of our daily work. We want to emphasize the model here, which is where NPs are supported to be leaders, to have their voices heard and participate in the growth and support of this program. They are good at telling us what they need, and we're good at listening. Although the programs often seem to just appear, anybody who's worked in program development knows the amount of work that is going on behind the scenes to make these available. Next slide, please. The regional leadership team was launched December 2019. Regional leads provide clinical and professional coaching, mentoring, and leadership. We act as liaisons with primary care networks, PCNs, provide role clarity, we answer questions, we are building relationships with multiple engagement partners, supporting the successful integration of nurse practitioners into these primary care networks. Honestly, anybody who wants to talk to us, we are happy to sit down and have discussions. The overall objective is to ensure that each of these regions is well supported from a leadership and mentorship perspective, and to help develop new nurse practitioner leaders. This program started with 2 regional leads and 1 director, and the director also acted as a regional lead. It has grown exponentially over just a few short years, where we now have, I think, 11 regional leads. We have a provincial Indigenous lead, our executive director, our director of the regional program, leadership program, and the director of operations, as well as our amazing admin team. Next slide, please. This is just a segue into the next part of our presentation, and this just shows you a list of the programs that we offer. So these programs are resources that are available to all publicly funded primary care nurse practitioners. So this includes health authority nurse practitioners, as well as independently contracted nurse practitioners. The first one, the mobile skills program that you will see an asterisk beside, just highlights that those nurse practitioners who work in health authority settings just need to get approval from their leadership prior to utilizing that program. And I am passing on to Annie.
Can I get the next slide, please? So I'm going to talk about a couple of the programs that are available for all publicly funded nurse practitioners. So the first one is Mobile Skills. So Mobile Skills program, so we have a robust group of subject matter experts that includes NPs, GPs, as well as physios throughout the province that who provide a variety of support to NPs. So topics that they can provide support on can include EMR super users, prenatal care, women's health, mental health and addictions, cardiology, as well as point of care ultrasound. Next slide. So the Mobile Skills team also has subject matter experts that can also support new NPs who are consolidating their practice. We also have an NP who provides expertise on cultural safety, our very own provincial Indigenous lead, Tara Reese. Next slide. So we are in the process of sunsetting clinical corners at this moment. As this program it was started during COVID when access to conferences for primary care providers were shut down. Clinical Corners offers educational sessions via Zoom from experts on a variety of topics. And now the program is being transitioned into collaboration with UBC CPD, and our regional lead, Kelvin Bay, will be heading our involvement. Next slide. We also offer remuneration for time spent maintaining college standards with respect to cultural competency and anti-racism education. So this is a list of courses that NP can access. However, it's not an exhaustive list. Next slide. We also offer funding for NPs who are not full voting members of their Division of Family Practice who are attending Division of Family Practice hosted events. Next slide. So Pathways is a website that provides access to information around specialists, care pathways and algorithms, and it also has resources that can be emailed directly to patients. Access to Pathways is also supported through our NNPBC Provincial Initiatives Program. Next slide. I'll pass this on to Chelsea.
I'm having a Zoom fail. So primary care nurse practitioners are eligible for 40 hours of QI funding per fiscal year, including QI projects and or QI education. Next slide. Thank you. We have a brand new QI project that has launched for nurse practitioners who are possibly new to QI. This program is a guided quality improvement project allowing nurse practitioners to take a snapshot of their current practice with the end goal of improving clinical efficiencies and ultimately help support provider wellness, which improves patient care. Next slide. Reimbursement is available for nurse practitioners who participate in Ministry of Health directed working groups and PCN directed committees, such as sitting at steering committees. We ask nurse practitioners to reach out to us prior to attending these meetings to ensure that they meet the criteria. Next slide. And one more. Yeah, thanks. The Shifted app is a community platform available for nurse practitioners who are looking for locum work, as well as for nurse practitioners trying to find locums for leaves such as parental leave or vacation time. Next slide. So this is a review of programs that are exclusively available for independently contracted NPs only, as there are equivalent programs available to health authority employed nurse practitioners. CPD funding is available prorated to $5,000 per 1.0 FTE per fiscal year for opportunities such as attending conferences. Licensing fees are reimbursable annually. Up-to-date subscription is available for reimbursement if not covered by the nurse practitioner's local division of family practice or PCN. Our provincial regional leadership team also offers one-to-one coaching and mentorship. We also have a monthly PCN NP specific newsletter, and we have monthly community of practice meetings on every second Tuesday of the month with relevant guest speakers and an opportunity to connect with other PCN NPs as well as the provincial regional leadership team. Next slide. So when and how to engage with your regional lead. It's a good time to connect when you're considering becoming a contracted PCN nurse practitioner during your negotiating process of your contract, as well as at any point in your practice when you need more support. Next slide. So what does this program mean for the future of NP practice in BC? It means that NPs successfully integrate into PCNs and into team-based primary care. PCN NPs can effectively meet all the expectations of their service contracts. They have the resources they need for the longevity of a successful clinical practice and continue to have professional growth through mentorship, coaching, and access to resources that support their integration into primary care networks. And ultimately, patients will have access to quality primary care. So we have tried to give some insight into changes that were made to NP practice over the last 5 years and the role that the NP Provincial Initiatives Program played. Next slide. And now for any questions from the audience.
Very quiet. I don't think I've ever given a presentation with no questions. We thought there would be lots of questions.
Well, if there is no questions, I guess we can give some people some of their lunchtime perhaps back. If any of the panelists have any closing remarks.
I do not have closing remarks. It is hard to give a webinar when you can't see anybody's face or know who's here. But I do appreciate your time. I do have closing remarks. I appreciate everybody taking the time to come and sit with us today and learn more about this program that we are all so very proud and fortunate to be involved in. And please feel free to reach out to any one of us. We all take calls from nurse practitioners from all over the province. You don't have to stick to your region, but know that we're here to help support you.
And then if any other questions about the webinar, you can reach out to info@nnpbc.com as well.
Excellent. Well, thank you all. Enjoy the rest of your day.